Many folks head into their top surgeries knowing that their chests are going to feel tight for weeks post-op, but what often surprises them is the amount of neck and back pain that can build up during top surgery post-op recovery. The good news is that there's exercises that you can do at home to decrease that tension and pain, and you can start those as early as week 1. And I'm going to show you exactly what those exercises are in this video, so hit that like button and stay tuned. Hello, I'm Dr. Sandy Baird. Welcome back to another video. If this is your first time here and you want to learn how to move better and how to get out of pain, start now by subscribing and click that bell notification icon so you don't miss a single weekly video. Neck and back pain going along with top surgery recovery is very common, but it's not very often talked about. So I'm going to show you in this video why neck pain and back pain builds up in the first place, and then I'm going to show you the exercises that you can do to relieve it. Between the muscle guarding or splinting that happens post-surgery or post-trauma, combined with the limited sleeping and resting positions that you might find yourself in the first few weeks of recovery, your neck and back muscles may be screaming out in discomfort. And I'm going to go in detail. I've actually done another video about exactly why muscle pain builds up, and that video is linked in the description box. It's how to fix your neck pain during a pandemic. I would encourage you to check that out if you want to learn more in detail at the cellular level into what happens with muscle pain. And you can also download my free guide to recovering from top surgery in terms of how to treat your neck and back pain that builds up. And so that's going to take you step by step, week by week, and it'll show you all the appropriate exercises and modifications you need to do for each of the exercises for each week of your top surgery recovery. So let's go right into the first set of exercises, starting with active ranges of motion for the neck. We want to start our active neck range of motions with a chin tucked to the chest for neck flexion, and then an extension all the way up and looking up towards the sky. So this should be a nice, smooth, gliding motion. And sometimes you'll hear a little bit of clicking or cracking, and that's totally fine as long as it's not painful. But once you do about 5 to 10 of these, you're going to start to feel like they're getting a little bit smoother the longer that you do them. And then the next motion that we're going to do after we finish up this one is pure rotation. So you're twisting to look over one shoulder and then turning your head to look over the other shoulder. And there's no thoracic motion here, so your shoulders aren't moving, your back isn't moving. It's just your head twisting. And so this is one of these things where somehow neck circles have become common in fitness circles, and the warm-up will be doing neck rolls. But the neck is not a ball and socket joint, so why would you do neck rolls? The next active range of motion that you want to do for your neck is side bending or lateral bending. And with each of these motions, we're aiming to do about 5 to 10 reps, or at least until things start to smooth out from side to side. Now we're moving into a combination movement. For this one, you want to keep your chin tucked into your chest the entire time. And as you move your head in a half circle here, it's almost like you're tracing the outline of the neckline of your shirt. So the next time that you fully roll your head over to the side, you're going to pause and you're going to look up in the opposite direction and then come back chin towards your shoulder and then continue into the semicircle. Same thing here. And you're just going to find a flow here. So it takes a few minutes to kind of get used to this new movement pattern. But you sweep around, you look up and away, come back through, and keep your chin tucked into your chest as you move through the semicircle. The next set of exercises is neck and upper back stretches. Now, if you currently have overhead reaching or lifting restrictions, right, meaning you're not able to bring your elbow above the line of your shoulder per your surgeon's recommendations, generally we're looking at about the first 6 months of recovery. That seems to be what most surgeons are recommending, at least on their websites. So if you're not able to bring the arm up above and come up into this kind of plane, don't worry about the step where I'm adding overpressure. You'll see that in the next clip. Just modify as needed, and then know that when you are able to reach overhead again, that's an option to deepen the stretch. The first stretch that we're going to do is for the upper trap. So you're going to tilt your head away from your shoulder and reach your arm for the ground. If you want a little bit more stretch, you can reach up with your hand and put a little bit of overpressure into the stretch. Now, we don't want to feel like our neck is crunched down like this. Grow nice and tall through the neck and then apply a little bit of overpressure. You want to hold this stretch for about 30 to 60 seconds. The next stretch is going to be for the levator scapula muscle, which is right behind that upper trap. And you basically change your head position, so you're tucking your chin down to your chest and then looking underneath your armpit. Another helpful thing that you can do to relieve muscle tension is to do some self-massage work with either massage balls or other massage tools. So the most tricky part is going to be getting in and out of the positions for the first few weeks of surgery. I would recommend getting a friend or partner to help you set up if possible. If not, there are ways to modify. So I would suggest the moves that I'm about to show you where you're laying on your back. You can actually do those inclined up on your pillows. Set your yoga block and ball as I'm about to show you in place and then get onto the setup. Or if you have someone with you, they can slide the yoga block and the ball into position. You can also do most of these exercises with your back against the wall. So if you have a ball like this, here's a hot tip. Grab a sock or a stocking or even a pillowcase, and you're just gonna drop the ball into the pillowcase or the sock, and that way you have a handle, right? So if you're not able to reach up overhead to reach back behind you, you're just gonna get this set up, and then you can, just kind of like come to whatever position you're able to come into, flip it back behind you, scoot it into place, and then that should be able to give you a little bit of a handle so you can go against the wall and maneuver the ball. And also, it's not going to fall. If you shift positions, you've got the handle right there. So give that a shot. Similar to the last set of exercises, there's some optional arm motions that I'm about to show you that you can skip if you have overhead reaching limitations, but I did want to leave them in the video so that you can see options for as you start to heal up and get further into your top surgery recovery, you'll be able to add those arm motions and deepen the work. So don't get hung up on exactly what's happening week by week. That's all in the guide. You just go into the description box below, download the free guide, and it lays everything out week by week. So for every exercise, you're going to know what's appropriate and which stage of your recovery. And one more note, I am a doctor, but I might not be your doctor. So please defer to any post-op instructions that your surgeon has given you and discontinue any of these exercises if they cause you pain. So with those disclaimers out of the way, let's get on to the self-massage exercises. For this first exercise, you can use 2 balls in the net that they come in, or if you don't have a net, you can just drop 2 balls into a sock. And then you're going to want a yoga block or a stack of books to put the balls on top of. Go ahead and lie on your back, and you're going to position the balls right underneath the base of your skull. So it's not underneath the middle of your neck, it's right at the base of your skull on your suboccipital muscles. And so once you've arrived in this position, it may feel like a lot of pressure, especially if you haven't done this before. So see if you can just take a few deep breaths and relax into the pressure. Once you've gotten used to the pressure a little bit, you're going to actively press the back of your head into the 2 balls. So you're going to do a press and then release. Press and then release. Press and release. And then you can also do a little bit of a gentle head nod here. So you're kind of nodding yes. And the balls aren't moving too much. It's just that you're getting a different angle of pressure on them right now. Go ahead and reposition the balls a little bit lower so that they're supporting the curve in the middle of your neck. And you're also going to want to scoot the yoga block more towards your shoulders. A couple of breaths here to kind of get used to the pressure. And then when you're feeling like you're ready, you can add a little bit of rotation. And so because there's 2 balls there, you're not going to actually rotate too far, but it can feel really good to rotate and get more pressure on the right side, and then rotate to the left and get more pressure on the left side, etc. The second exercise is very similar to the first in terms of the setup, but for this one we're just using 1 ball placed right in the center of the neck. And as I rotate my head to the side, I'm actually pushing down into the ball harder than I am in the neutral position. So this is a really nice way to get into the soft tissues of the side of your neck. To release the upper trap muscle, I'm going to put 1 ball underneath my upper trap. And then the higher you lift your hips on this exercise, the more pressure you're going to feel. So I have a yoga block tucked underneath my sacrum so that I can relax my hips once I've gotten to my ideal level of pressure. And I'm going to show you a few different options you can do here to add to this move, like moving your arm back and forth, using your heels to rock your body into the pressure, or even moving your head away from the ball. But if you get into this position and you feel like this is just wonderful and it feels effective and you want to just hang out on that spot, then there's nothing wrong with it just coming to a still position and just taking some breaths for up to a minute or 2 minutes. So I'm showing you here how you can use your heels to gently move your body in and out of pressure, and then also how you can move your head away from the pressure point. So sometimes it feels like you can create a little bit of a stretch with pressure. The levator scapula muscle is right behind the upper trap. So all you need to do is slide the ball back and down just a little bit. And then again, you have some options here. So if it feels really nice to just stay on this spot and breathe, that is definitely one option. You can also add in some arm movement if that feels good. You can also use your heels to rock your body in and out of the pressure. And I'll show you those options here in a moment. So I'm using my heels just to push the mat away from me. And now I'm adding in some arm motion too. Just a couple of options. You have to just play with what feels good for you. If it's too much pressure, you can take the yoga block out from under your hips and just come down to the ground with your hips. Another option here is to kind of squeeze the ball between your shoulder blades and then reach for the sky. You're going back and forth, squeeze and reach, squeeze and reach. Sometimes reaching across feels better. It's just up to you. Everybody's body is a little bit different, so I'm just showing you a few options here. And then this is kind of a bonus, but if you scoot the ball a little bit further down, you're going to be onto the tissue of the rhomboid muscles. And it could be nice to just come back down to the ground for this one. We don't need to drive that much more pressure on it since it's just naturally going to have more pressure in that position. And then again, adding arm motion can just challenge things and make it feel like we're pinning the tissue down and then stretching it. But it can also be nice just to hang out on one spot that feels really tight and feel it release. So I've shared some amazing tips and tricks with you today to help minimize your neck and back pain at home. But if things have built up for too long or they're just not going away at home, know that help is available. A sports chiropractor or physiotherapist can help you out with this kind of thing. I'm based in Oakland, California, and I would be happy to help if you're nearby. Chiropractic care may look a little bit different than what you're used to, right? You may think about chiropractic care being on a table face down, and for the first few weeks of surgery, that's not going to be the most comfortable position at all. So it may look a little bit different. Some of the work may be done in a seated position, and as the weeks go on and we're getting towards week 6 and things like that, you may be able to be supported face down with a chest pillow or bolster or body cushion, things like that. So we just have to be a little bit flexible and creative with the positions. But again, chiropractic care is indicated at any stage. It's just a matter of being able to get to the appointment, right? I mean, you got to like coordinate your transportation because you can't drive right away. Maybe you don't have a lot of energy to get to an appointment. But once you've gotten to an appointment, there's definitely work we can do in a variety of positions to help minimize your neck and back pain. So don't hesitate to reach out if you think that that might be something that would be helpful for you. One other note, if you are having like radiation of pain or tingling, numbness, weakness, anything down your arm, that's something you want to get checked out by a professional. But if we're talking about like an achy, stiff, kind of crunchy situation that you're dealing with, try the exercises in this video, get my guide that's down in the description box, and that should help you out a lot. I hope you found this video helpful. If you did, please hit that like button and share it with your friends who may be going through a similar recovery process. And if you'd like to subscribe to my channel, you can do that right over here. And there's other videos right over here that you might be interested in as well. All right, thanks for watching. We'll see you on the next one. Bye.